All right, diving in today. Red lesions in the mouth. Sounds kind of basic, right? But trust me, you've shared some sources, and it gets pretty interesting. We're talking everything from little annoyances to things you absolutely got to get checked out.
Yeah, and it's not always obvious, right? What's harmless and what's not. That's what we're going to unpack.
Exactly.
Yeah.
So think of this as your guide to red spots in your mouth.
Yeah.
What they could mean, what to watch out for, and when to, maybe not panic, but definitely call your dentist.
For sure. And the cool thing is these red spots, they can come from so many different places. Like think genetics things you're born with, or maybe just something rubbing wrong in your mouth. Infections, bacterial, fungal, even those, what are they called? Neoplasms.
Neoplasms, yeah, scary ones. Well, we'll get to those. First, let's start with what you're born with, congenital red lesions.
Right, right. And the sources are really clear about separating these two things, congenital hemangiomas and vascular malformations. They sound similar, but under the hood, totally different.
Okay, so break it down for us. Hemangiomas versus malformations. What's the key difference?
Think of it like this. Hemangiomas, they're basically benign tumors, but specifically in infants. Now, the key here is endothelial cells, the cells that line your blood vessels. They go kind of crazy in hemangiomas, multiplying like crazy, making this growth.
So a burst of growth, and then what?
And then, get this, they involute, shrink, disappear, like poof. So hemangiomas are all about growth, and then gone.
So they kind of self-destruct. Is there something that triggers them?
Not exactly. It's more like a developmental thing.
Yeah.
Weird, right? And most of them, they're not even there at birth. They pop up like a few weeks in, soft tissue, sometimes bone. And actually, they're the most common tumor in kids, more common in girls too. Oh, and you usually find them in the mouth, like on the tongue, gums, inside of the cheeks.
Interesting. So they appear, grow, and then vanish. Now, what about vascular malformations? How are those different?
Vascular malformations are, it's more like a plumbing issue. The blood vessels themselves are formed wrong, structural. So the endothelial cells, they're not multiplying like crazy. Their turnover is normal. It's the vessels themselves.
So it's a built-in problem, not a growth problem.
Exactly. And because of that, they're there from day one, and they stick around, present at birth, persistent throughout life.
Yeah.
Totally different from those disappearing hemangiomas.
Present and persistent. Got it. Both of them, they can be red or blue, right? What's up with that?
Yeah, so that's all about blood flow, how much blood is in the vessels, and how deep they are in the tissue. Simple as that. And they're also grouped by vessel type. Capillary malformations, those are small vessels. Cavernous malformations, larger, kind of thin-walled. And the important thing is, if they're big and don't go away, you might need to do something about them. Surgery or maybe sclerotherapy. That shrinks them.
Okay, so to recap, hemangiomas, they grow and regress. It's all about the cells. Vascular malformations, structural, permanent, might need intervention. Now, the sources mentioned two other weird ones that are congenital, encephalotrigeminal angiomatosis and hereditary hemorrhagic telangiectasia. Let's start with the first one. What is it and why should we care?
Encephalotrigeminal angiomatosis, or Sturge-Weber syndrome. This one's, well, it's kind of fascinating. You get this port wine stain, right? But it's not just any birthmark. It's a specific type of hemangioma, a macular hemangioma that follows the path of the trigeminal nerve.
So a red mark on the face along a specific nerve. Okay.
And
Count.
here's the kicker. Similar vascular abnormalities, they happen inside too. In the meninges, those are the membranes around the brain and even in the brain itself. So you get neurological problems, seizures, developmental issues, even glaucoma. And of course, we're here for the mouth stuff, right?
Right. So inside the mouth, what's going on?
Inside the mouth? Well, you see more blood vessels. Hypervascular changes, they call it, usually on the same side as the port wine stain. And the gums can get a little overgrown too, kind of a hyperplasia thing, but that might be from the extra blood vessels or from the anticonvulsant meds they use for the seizures, or both. It's complicated.
So facial birthmark, neurological stuff, and then changes in the mouth on the same side. Makes sense. Now, that other one, hereditary hemorrhagic telangiectasia, how's that different?
Phew. That's a mouthful, right? They call it HHT for short, or Rendu-Osler-Weber syndrome. It's a hereditary thing affecting skin and mucous membranes. And the thing you see are these telangiectasias. They're little dilated arteries close to the surface, look like tiny spiders, basically.
Spiders, huh? So they have that radiating pattern, and they can show up anywhere.
Everywhere. Internal organs, like liver and lungs even, there they can form these arteriovenous fistulas, basically abnormal connections between arteries and veins. And outside you can see them on the face, neck, chest, lips, gums, tongue, even inside the nose.
So all over the place. Are there any early signs?
Yeah, actually. Frequent nosebleeds, that's often the first clue. And this is where, being a dentist or hygienist, you might see those little red spots in the mouth and put two and two together.
Ah, so the mouth can give you a heads up about something bigger.
Exactly. Because those telangiectasias, they're fragile, they can rupture, and then you get, well, more problems.
Hmm.
Bleeding in the gut, anemia from iron deficiency, even blood in the urine. So those tiny spots, they can be a sign of something serious.
Wow. Tiny spots, big consequences. It's like a warning light on the dashboard, right? Okay, so those are the red lesions you can be born with. Now, what about the ones that pop up later? The reactive ones.
Right. So those are acquired, not congenital. And the first one is pretty simple. Merrick's, basically a dilated vein, like a tiny varicose vein, but in the mouth.
So wear and tear on the veins, basically.
Mm-hmm.
And where do they usually show up?
Usually under the tongue. Sublingual varix. Less often you see them on the lips or cheeks. They look blue, and if you press on them, they blanch, go white.
Yeah.
And usually, they don't cause any trouble. No treatment needed.
A blue spot that disappears when you press on it. Check. What's next?
Perulis, or as some people call it, a gum boil.
Ah, the infamous gum boil. I think most people have heard of those.
Yeah, they're pretty common. It's basically a reddish bump on the gums. And what's happening is there's an infection at the root of a tooth, a periapical abscess. And the pus from that abscess, it needs to go somewhere, right? So it finds the path of least resistance, pokes out through the gums. That's the perulis.
So it's like a little escape road for the infection. Ouch.
Exactly. And it hurts like hell until it drains, and then relief, usually. One way to tell it's perulis is the tooth won't react to cold or that electric pulp test. That means the nerve's dead.
But how do you know which tooth is the bad guy?
Well, it's not always the one right under the boil. Sometimes it's a bit sneaky. They have this trick where they stick a gutta percha point, that's a root canal material, into the opening. Then they take an x-ray. The point leads you right to the source of the infection.
Like a little map, huh?
Yeah.
Smart. And then root canal or extraction, depending on the tooth. All right, what's next on our tour of mouth thumbs?
Pyogenic granuloma. Scary name, but it's a bit of a misnomer. It doesn't actually have pus, and it's not a true granuloma. It's more like an overgrowth of tissue, lots of blood vessels, usually triggered by some kind of irritation, like a filling that's not smooth or tartar buildup.
So the teacher's basically saying, hey, something's poking me, and it overreacts.
Yeah, something like that. And because it's so full of blood vessels, it's super red, bleeds easily. It can look like a little mushroom, or sometimes just a lump. And the gums are the most common spot, especially where there's tartar or something stuck, but you can get them on the tongue, lips, cheeks too. And they're easy to, ulcerate. Yeah, they get little sores easily. Oh, and pregnant women, they get them more often. Hormones, Sometimes they call them pregnancy tumors. But the good news is they often go away on their own after the baby's born.
Hormones. Gotta love them.
Oh.
So irritation is the key. What about treatment?
Clean up the area, get rid of the irritant, and then they usually just cut it out down to the bone to make sure they get it all. But sometimes they come back, maybe 10-15% of the time.
All right, so pyogenic granuloma, irritation, red bump, cut it out. What's next?
Peripheral giant cell granuloma. This one's only on the gums or where teeth used to be. It can look a lot like a pyogenic granuloma, honestly. Pinkish, reddish, maybe even bluish.
So how do you tell them apart? Location, I guess?
Yeah, location helps. This one likes to hang out on the lower jaw, usually between the molars and front teeth. And it's also, it can be kind of a bully. It can eat away at the bone underneath. You can see it on an x-ray, a little cup-shaped area. That's how you know it's not just a surface thing.
Bone loss, that's no joke. So what are these giant cells all about?
So those giant cells, they're part of the body's response to irritation. But sometimes they get a little overzealous and start breaking down the bone too. Not ideal. They cut this one out too and scrape away any affected bone. But it has a higher chance of coming back than the pyogenic granuloma, like maybe 15-20% of the time.
So similar look, but this one's more aggressive. And the last one in this category is Epilis granulomatosa, right? What's that all about?
Epilis granulomatosa is basically, it happens after you get a tooth pulled. It's an overgrowth of tissue in the socket, and the culprit is usually something left behind, like a tiny piece of bone or tooth. It's like the healing process gone wrong.
A little souvenir from the extraction, huh? Not the kind you want.
Exactly. It's soft, bleeds easily, and they just scrape it away. Easy peasy. Well, mostly. Okay, so we've tackled those two big groups, congenital and reactive. Now, let's move on to some internal stuff, things happening inside the body that can cause red lesions.
All right, internal mystery. Let's crack the case. What's first?
Plasma cell gingivitis. It's an immune system thing, often triggered by, wait for it, chewing gum.
Chewing gum, seriously. That's all it takes.
Sometimes, yeah. Allergies, it usually affects adults, sometimes kids. They get this burning feeling, mouth, tongue, lips. Comes on pretty suddenly, and it comes and goes.
So unlike burning mouth syndrome, this one actually looks different, right?
Yeah, you see the inflammation, the redness, and under the microscope, the tissue is all swollen, full of inflammatory cells.
Stop chewing gum, problem solved.
Usually, yeah. Or if it's certain toothpaste, switch to a different one. Easy fix if you know what to look for.
That's good news. Now, what about drug reactions? We talked about allergies to toothpaste, but this seems bigger.
Yeah, this is about any kind of drug, pills, injections, even stuff you put directly in your mouth. And it can look like a skin allergy, basically. Redness, hives, even blisters.
So new medication, sudden redness, maybe think about an allergic reaction.
Exactly. Oh, and sometimes if it's on the tongue, it can mimic a vitamin deficiency. Tricky.
Ah, the tongue, always throwing curveballs. Now let's talk about the elephant in the room, or rather the burning sensation in the room. Burning mouth syndrome.
Ah, yes. This one's a doozy because, well, often there's nothing to see. The mouth looks totally normal, but the patient feels this intense burning.
So it's all about sensation, not appearance.
Right. And that's what makes it so hard to diagnose. Because, a red lesion, you can biopsy it, look under the microscope, but with this, you got to rule out everything else first. Could be a vitamin deficiency, anemia, fungal infection. And if it's none of those, well, then it's probably burning mouth syndrome.
Talk about frustrating.
Yeah.
But if there's nothing to see, what's causing the burning?
That's the million-dollar question. They think it's multifactorial. Could be microorganisms, dry mouth, nutritional deficiencies, hormones, even psychological stuff like anxiety or depression. And sometimes, well, sometimes you just don't know. Idiopathic, they call it.
So a whole bunch of maybes. Who gets this typically?
Middle-aged women mostly. Men too, but later in life. Rare in young people. And the treatment, well, it's more about managing symptoms, honestly. Antifungals sometimes help, even if there's no obvious infection. Steroid creams, maybe lidocaine for a quick fix. But the real game changer is often antidepressants. They can help with the nerve pain.
So it's a long road, potentially, with burning mouth syndrome. And no easy answers. Okay, moving on to infections. Let's talk about the fungal ones first, specifically candidiasis. Most people know it as thrush.
Yeah, thrush. It's caused by Candida albicans, a fungus that's, well, it's actually usually hanging out in your mouth already, just chilling. But it's an opportunistic bugger.
Yeah.
Give it a chance, weaken the defenses, and bam, infection.
So it's waiting for its moment to strike, like after a round of antibiotics.
Bingo. That's what they call acute atrophic candidiasis, or antibiotic sore mouth. You get these red, smooth patches, painful. And the treatment, stop the antibiotics if you can, and hit it with some antifungals.
Makes sense. Antibiotics wipe out the good bacteria, giving Candida free rein. Now, what about denture stomatitis? Is that Candida too?
Yep, same culprit. This one's all about dentures, especially if you wear them all night. It starts with redness under the denture, then maybe some bumps. Papillary hyperplasia, they call it.
So not just the fungus, but the denture itself is irritating things too.
Exactly. It's a combo deal.
Yeah.
Treatment, denture hygiene, antifungal meds, and sometimes they got to trim those bumps away before making a new denture.
Okay, denture hygiene noted. What about median rhomboid glossitis? What a name.
Right. This one's easy to spot. It's a red, smooth patch on the tongue, kind of diamond-shaped. No little bumps there because the papillae, those little, what are they called? The little farm papillae, yeah, those are gone. And it's usually painless. They think it's another type of candida infection, often seen in people with diabetes or weak immune systems.
So a smooth red diamond on the tongue. Got it. And what about angular cheilitis? That's those cracks at the corners of the mouth, right?
Yep, that's the one. Cracks, redness, soreness. It can be candida, but also bacteria or even just dry mouth. Sometimes it's a vitamin deficiency. And treatment depends on the cause, of course.
So many possibilities. Gotta love the mouth, right? Okay, what about bacterial red lesions? Any standout players there?
Scarlet fever, childhood classic, caused by strep bacteria, sore throat, fever, rash, and the tongue. Oh, the tongue.
Yeah, what about the tongue? So I feel like there's a story there.
First, it's white with red bumps like a strawberry. Then the white goes away and it's just beefy red. Red strawberry tongue, they call it, or raspberry tongue. Untreated, it goes away on its own, but they usually give penicillin to knock out the strep, prevent complications.
Raspberry tongue. Vivid. Okay, on to the last category. The neoplastic red lesions. This is where things get serious, right?
Yeah, these are the ones you don't want to mess with. Erythroplakia is the first one. It's basically A red patch. But that's just the description, not a diagnosis. You got to biopsy it to know for sure.
So red patch, no big deal.
Hold on. Here's the thing. Erythroplakia is often a sign of something bad brewing. Dysplasia, precancerous changes, or even full-blown cancer. Like, half the time, it's already squamous cell carcinoma when they biopsy it.
Whoa, that escalated quickly.
Yeah, that's why you got to take it seriously. They cut it out, wide margins to get it all. And follow-up is super important because it can come back.
So red patch, don't ignore it. Biopsy is key. What about Kaposi's sarcoma? I know that one's linked to HIV, right?
It is. Well, not just HIV, but any kind of weakened immune system. It's actually caused by a virus, HHV8. The virus needs that opportunity, a suppressed immune system. Then it can do its thing.
So the virus is lurking, waiting for its chance. What does it look like in the mouth?
It can be
Yeah.
tricky. Early on, it might just be a flat red or bluish area, but then it can grow, become lumpy, nodular.
So it can change over time. And where does it usually show up?
Palate, gums, tongue, pretty much anywhere. And people with HIV, they often have other mouth problems too, like thrush or gum disease. It's a whole package deal, unfortunately.
So red or blue, flat or lumpy, sounds like it can mimic a lot of things.
It can. That's why the biopsy is so important. And they have this special test, immunohistochemistry, where they can look for the virus itself.
And treatment.
Well, if it's HIV related, the best thing is to get the virus under control. That usually helps the lesions too. But they also use chemo, radiation, sometimes surgery. It depends on the case.
So a lot to consider with Kaposi's sarcoma. And with that, I think we've covered a lot of ground, haven't we?
We have. We've gone from those little harmless bumps to some pretty serious stuff.
Yeah, it just goes to show that a red spot in your mouth is not always what it seems. Could be nothing. Could be something big.
Exactly. That's why if you see something that's not going away, or if it's changing, or if it just bothers you, go get it checked out. Don't wait.
Solid advice. And, this whole conversation, it really makes you think, doesn't it? About how everything is connected. What you eat, your stress levels, your overall health, it all shows up in your mouth.
It's like a window into the body, the mouth.
Exactly.
Yeah.
So pay attention to those little signs. They might be trying to tell you something important. And that's your takeaway for today, folks. Tune in next time for another deep dive into, well, who knows? The human body is full of surprises.